So surgery is the only treatment for varicocele. You cannot become a father if you have varicocele, or there is no natural cure for varicocele, and many other such statements that you might have also heard from doctors or friends that create unnecessary fear and confusion among the men dealing with this condition. Hello everyone, I am Dr. Himanshu Dhawan, and today we are going to talk about a common yet misunderstood conditions, varicocele. Before starting, see some before and after reports for patients who have recovered from varicocele without surgery and are happily continuing their life. If you or someone you know is struggling with this issue, this video is must watch. First, the biggest myth that I hear all the time is that if you have varicocele, you cannot become a father. This is a completely wrong. Having varicocele does not automatically mean you will facing infertility. In varicocele, the temperature of testicles rises above the normal temperature. That affects sperm production and quality. When there is varicocele, the temperature of testicles can rise by 1, 2 or 2 degrees Celsius, which can negatively impact sperm production and motility. However, this does not mean that every man with varicocele will experiencing infertility. Many men with varicocele have a normal sperm count and father children naturally. If you think your fertility is getting affected, get a semen analysis test done to check parameters like sperm count, motility and morphology. Second, surgery is the only treatment for varicocele. This is the one of the biggest misconception. Surgery is not the permanent cure, because what happens is that in surgery, problematic veins are cut off and tied again. However, there is still the chance of varicocele reoccurrence, because suppose there are 20 veins in the scrotum, out of which 4 problematic veins are cut off and tied back. Now, all the blood that was circulating earlier through 20 veins have to be now circulated through the remaining 16 veins. This puts additional pressure on them, which can eventually lead to a development of new varicocele over the time. This is why many men experiencing reoccurrence even after surgery. Moreover, surgery does not address the root cause of varicocele, which is weak veins or poor blood circulations. Instead of opting for surgery as the first solution, it is important to focus on improving blood flow, reducing the inflammation, and prevent blood from pooling inside affected veins naturally. Find the root cause that lead to the development of varicocele. For example, in some patients, it can constipation that puts extra abdominal pressure on veins and worsen the varicocele. As many people don't realize that issues like constipation, IBS or poor digestion can make varicocele worse. Think about it. If you are constantly straining due to constipation, you are putting additional pressure on the veins in your lower abdomen, which can aggravate the conditions. If you notice any sign like constipation, bloating, frequent urge to pass stool, or unsatisfactory feeling even after passing stool, then this might be the main reason behind your varicocele condition. In others, it might be prolonged sitting, excessive weightlifting, or even poor dietary habits that weaken the veins over the time. So identifying these triggers is crucial, because treating varicocele is not just about cutting problematic veins. You should focus on treating the root cause for permanent cure. Third myth is varicocele always cause pain and discomfort. No, not at all. Because every person experiencing varicocele differently. Some men may feel no symptom at all, while others may experiencing mild discomfort or a dull ache, especially after the prolonged standing or a physical activity. Pain due to varicocele occurs because the veins in the scrotum become enlarged, leading to blood pooling and increasing the pressure, which cause discomfort. However, not everyone with varicocele experiencing pain, and those who do may notice it occurring at different times and in different intensities. Some men feel pain intermittent, maybe once a week or after engaging in certain physical activities. Others notice discomfort after prolonged standing as being or their feet for extending periods, increasing pressure in the veins, making the pain worsen. Many men report that the pain is more noticeable after heavy lifting or intense workout like weight training, running or cycling. This happens because these activities increase blood flow to the lower body, and if the veins in the scrotum are already weak, they struggle to circulate the extra blood efficiently, leading to the pooling of blood that results in pain and discomfort. In some cases, varicocele pain does not stay localized to the scrotum but spread to the lower abdomen, inner thighs, or even the lower back, which is referred to as a radiating pain. So, do not assume that you will suffer from constant pain if you have a varicocele. If you notice any swelling without pain, then also you must get a USG scan done to get confirmation and find the right reason for swelling. In varicocele, testicles swell due to inflammation, which occurs as a result of increasing pressure in the veins and improper blood circulation. To manage inflammation and reflux, focus on improving circulation. Fourth, widely spread myth is there is no natural treatment for varicocele. This is completely wrong. There is a natural cure available for varicocele. To treat varicocele, we need to work on three things. First is to improve blood circulation. Second, reduce inflammation and refluxes. And third is treating problem that puts extra pressure on veins. Listen to this patient who was advised surgery at first, but he was able to recover naturally.
For about a year, I had a problem with varicose veins, which caused me a lot of discomfort. I took a lot of medication, but it didn't provide any relief. Then I found out about Dr. Himanshu Dhawan online, and from his clinic, Dr. Hales, I got Ayurvedic medicine, and I only took this medicine. I used it for 5 to 6 months, ordering the pack twice, and it brought me a lot of improvement. Today, my varicose vein problem is almost 100% cleared, and there is no issue or problem. I just used the medicine, ordered it online while sitting at home, and my problem was resolved.
Now, the main question is, what should you do if you have varicocele? If you have varicocele, the first thing you should do is work upon the curing yourself internally. I always tell my patients, your body has an incredible ability to heal if you give it the right environment. The best things you can do to recover internally is to include specific exercise that improve blood flow in the pelvic area. You can do leg raise exercise, which are a best exercise for improving blood circulation and reducing refluxes. When you keep your legs in a higher position than your body, the blood flow in the anti-gravity direction in the pelvic region, which helps in better blood circulation throughout the affected area. This helps in reducing swelling or preventing blood pooling in the veins. Additionally, Malasana, which is deep squats, and the butterfly pose are highly beneficial as they help in stretching the pelvic muscle, improving blood flow, and relieving abdominal pressure. These exercises also promote healthy bowel movements, preventing constipation, which is a key contributor to varicocele worsening. If refluxes are present, these exercises can also help in reducing pain and inflammation by easing the strain on the veins. These exercises are not just beneficial for varicocele, they also help with overall reproductive and pelvic health. If you are concerned that your fertility might get affected with varicocele, then these exercises can become a game changer for your fertility. Next, come in your diet. I always tell my patients food is a medicine. If you nourish your body the right way, it can heal itself. In diet, you should focus on antioxidant rich diet and must intake easy to digest food. Now the final and the most important step, choosing the right treatment. If you are looking for a natural holistic approach to treating varicocele without surgery, first try to make lifestyle changes. Include exercises that I have shared with you in your diet routine. Follow a proper diet. I will share the varicocele diet video with you in the description box. If you still have a question regarding varicocele and want to know more about how you can cure it naturally, then you can reach out to my team, share your reports with us and get the right solution. If you found this video helpful and informative, like this video, subscribe to our channel and stay tuned for more such helpful information. See you in the next video. Take care.